This program is intended for informational purposes only and does not contain medical advice. As always, please contact your physician or qualified healthcare provider with any questions regarding a medical condition. Perimenopausal women, we have so much to worry about. You know, men barely have anything to be concerned about.
That is not true because they suffer from ED.
Oh, that is a fact. Sorry.
It is pretty common, very common, very common.
And Hims is...
that's their primary focus in the beginning.
Wow. Hey guys, thank you so much for joining me on another episode of Hot and Bothered with Melyssa Ford. I am Melyssa Ford. Today's episode is about something that I hear so many people talking about, but it seems like nobody has any real information. Just a lot of misinformation is just kind of floating out there in the ether, and I really wanted to try to provide everybody with a very thought-provoking, compelling interview that is full of information that might actually educate you on this particular subject. So I'm going to introduce my guest in just a second, but as we all know, weight loss trends pop up every 5 seconds. The weight loss and healthcare industry is a multi-billion-dollar industry, and a lot of us kind of get caught up in what is the newest and greatest trend without really fully understanding what its cause and effects and long-term effects might be. Not sure if any of you remember the Master Cleanse, but I do, and that was completely ridiculous. So what we've seen as well is we've seen a lot of television commercials recently for something called Ozempic or Wegovy or Mounjaro. And up until recently, they were really marketed as medication for type 2 diabetes. But as of late, they seem to be marketed as weight loss aids. And now your favorite celebrity who seemed to have been struggling with weight loss is now turning up all slim and svelte, but they're not really admitting how they went about doing it. Maybe they went about it, the tried and true method of, diet and exercise and drinking a lot of water and cutting out alcohol and sugar and whatnot. But I think the vast majority of us are a little bit more sophisticated, and we have an idea that they might have had some help. And so what I want to do is I want to talk to a professional who deals specifically with weight loss management and uses these types of medications, which are called peptides or GLP-1s. These are terms that you might have heard as well. Today, I'm speaking with Dr. Cynthia Sanchez, a board-certified emergency medicine doctor who, in her private practice, works directly helping people with weight management and is also a provider with the Hims and Hers telehealth. Dr. Cynthia, thank you so much for joining me today.
Thank you so much for having me.
Oh my God, I have been waiting for this interview for so long because I know that there's just so much information kind of like, floating around out there. There's misinformation. Right now there's a class action lawsuit against Ozempic.
Yes.
And, every time I look at a blog, it seems like, somebody is having some kind of health scare or some kind of, health issue when it comes to taking these medications. So I want to give the audience a chance to understand what these medications actually are, what they're defined as, how they're meant to be used, right, who might be the best candidates for it, and who might actually not be a really good candidate for it. But what I'd really like to do is I'd like to start with, with you and your early start. So you grew up here in New York City in Washington Heights.
So I grew up, I was born in, New York City in Washington Heights. I grew up primarily in New Jersey, and I went to college at Montclair State. And in that time, I guess, growing up, had no doctors in my families, didn't really know much about medicine, first generation, American really. Both my parents immigrated from Dominican Republic. And my mom always put this thought in my head, like, you're really smart and you should be a doctor, you should do this. And I honestly didn't think that it could be possible, but somehow I got into pre-med courses and I got into medical school, and that was through a lot of volunteering, a lot of mentorship in hospitals around in the Bronx area, and I became a doctor, and I'm like the first doctor in my family. So that comes with a lot of pressure.
Holidays must be really interesting. Like, do you have to bring like a blood pressure cuff with you?
My mom tells me to travel with it. No, honestly, it's not even just holidays. It's constant text messages from family, from friends. I do constant like free consultations. That's what I tell people all the time. But it's honestly, I feel like I'm blessed, to have this opportunity to help family and friends. And then I also realized just me and my kind of my circle, I really, really learned a lot about how not misinformed, but just the poor education in general that we have of our bodies and just like basic things that
superstitions,
we don't, right,
things like that, old wives' tales.
Exactly. So, and then in turn, when I went to medical school in Long Island, I ended up really finding a passion for emergency medicine. I also was an EMT early on, and in emergency medicine, especially in the Bronx, we did a lot of primary care just because of just not having a lot of resources available to them, and, going to doctors that they have long wait lists of, patients. And there I learned a lot about really the emergency room is not the best place for preventative medicine. I tend to focus a lot with patients on mindfulness, and I tend to, people in the emergency room, it's usually a quick in and out, and I tend to like spend an extra like 10 minutes. So a lot of times I used to tell, my attendings, usually like, wow, you were in there for a long time. And I'm just like, I just feel like, especially in that sense, you have to try to connect with people because especially in the emergency room, some people are there on their worst day of their life, their best day, or, and you try to have to build that trust in order for them to kind of divulge a lot of information that they may not have told anyone, or they just want to know what's going on. And sometimes you have to be a detective and just try to extract that information. And I think, that psychology basis helped me a lot.
It's interesting how many times, I interview a lot of doctors now and have in the past, just because I'm always, my psychology training always, leads me to want to know, just kind of like how people do their jobs, like from what is their approach and that sort of thing. And also I'm just kind of fascinated by, people who have to deal with a high volume of people at all times and how they stay sane. What is their methods of like, keeping themselves sane? And so one thing that I wanted to ask you, because, I watched Chicago Med and we were introduced by Dr. Femi and I, had to ask him, I was just like, are there any medical procedural dramas that you as a doctor can even stomach? Because I'm sure you're just like, oh my God, please. Like, this is so convoluted and stupid and that's not right and blah, blah, blah. So Chicago Med happens to be one of my favorites, and so the emergency room looks like chaos all the time. Code red. Right. We got a bus coming in. Multiple casualties. I'm like sitting there watching like on the edge of my seat and whatnot. Is that what it's really like?
Well, I will say some days, yes. In the Bronx, there were a lot of times where you're like, what, is this real life? But I will say those shows tend to kind of glorify as far as like the heroic things of like doctors and make it seem like that's an everyday thing. But a lot of times it's not so much of what you do in the procedure. It's also how you effectively communicate with the patients that really make the difference.
So take us through a day in emergency medicine. What does an average day look like?
So an average day, pretty much I walk into the ER and let's say one of the busiest days in the emergency room, which people know, is Monday. So why
is that?
Sometimes the weekend kind of things happen and people don't want to get stuck in the ER on the weekend. So they're like, I'll figure it out on Monday. So we get a lot of like Mondays pretty busy, Monday, Tuesday. And, I may walk into the first patient who may be an 80-year-old with chest pain. Or the next patient I'll see back to back will be like a 45-year-old with abdominal pain. So you have to try to differentiate, one, the age range. Sometimes I'll see a pediatric who's coming in with like a fever or a sore throat. So it's also the range of how, I guess, the triage and the severity of the conditions. And you have to kind of say, well, these people all came in around the same time. Who am I going to see first? So it's a lot of decision making.
Yeah, emergency medicine seems like this like huge smorgasbord of cases, you know, where it's just like you go from dealing with, you know, an elderly patient with chest pains who's 80 years old to a child and everything in between. So it's just like, how does med school and residency prepare you for just anything that just seems to like kind of fall off the wall, you know, just.
So I will say my training.
It doesn't seem like it's just like a very specific field, whereas like proctology is extraordinarily specific.
Yes, exactly. And their expertise. So we're considered to be the jack of all trades. So we are going to stabilize the patient. We know how to intubate. We know how to save a life. We know how to stabilize the patient. And if they need surgery and they need further higher level of care, we're going to transfer them to, if it needs a surgeon, if it needs a heart, you know, a cardiologist. But in general, we need to know a little bit of pretty much every specialty. Okay. And it's just when it comes to stabilization. So I like to say that we're the doctors to stabilize the patients. So you may come into a cardiac arrest. What the thing is about emergency medicine, it's very unpredictable. So you have to have that personality of being adaptable. Also multitasking. It's not so much also of what the patients, the multitude of patients. There are going to be nurses coming up to you. There's going to be techs coming up to you, dropping EKGs on your desk. And then at the same time, you're like, oh, I need coffee too. Like I just got here. So it's a lot of things that you have to have the personality for it. And it's also one of those doctors that the ER never closes. So I work nights. I have to work holidays. You know, those are things that the cardiologists and certain other physicians have the privilege of, like closing the office or not being on call or things like that. So when it comes to emergency medicine, I feel that when it comes to residency and the training for it, it's a lot about volume. So seeing different cases, seeing the differences of how people present. You know, not everyone presents with a heart attack the same way.
That's true.
Definitely not, especially depending on age, depending on gender, and also having to educate a lot.
What are some of the unique ways that women present as having a heart attack or a cardiac event? Because, you know, what we see on TV is usually, and it seems like this is more like the male kind of response, which is, you know, oh, you grab your chest, the left arm goes, you know, starts to tingle and whatnot, and then that's what it is. But apparently with women, it's the signs might be a lot more subtle and might not be as immediate as it shows up in men.
So women definitely present completely differently. The number one, it's not that crushing chest pain that they're holding on to their chest. It's usually abdominal pain or shortness of breath.
I've never heard that.
Or shortness of breath. Okay. So all my nurses and everything, any woman that's presenting with upper abdominal pain usually gets an EKG. That is something that across all emergency rooms that has been now shown because there have been so many studies of how women present differently than men. Also shortness of breath. Mm-hmm. So they may not feel that pain or pressure. And I think it also has to do with, in general, women have a much higher tolerance for pain.
That is a fact. And I wish we got a lot more credit for how much pain, both physically and emotionally and mentally, we can tolerate.
Definitely can tolerate a lot more pain. So it'll be a lot of subtle things that you kind of just look at their faces and you kind of can get a feeling like, are you like, well, then.
And we're so used to saying, I'm fine.
Right.
I'm fine.
Exactly.
My family made me come in. I don't want to be a bother. And you're like, you're about to die, lady.
Yes. They downplay it. Like, it's not really pain. It's like pressure or it's just tightness, or they use different terms versus, I do see men are like, oh, I'm just uncomfortable. I'm in pain. You give me something right away. So it is definitely a difference. And women also can even present with just nausea.
Wow.
Like a very subtle symptoms. Mm-hmm. And you'd be very surprised that you get their EKG and it's like, ma'am, you're
about to have a massive event.
Heart attack.
Yeah. Okay. Well, let's switch gears and talk about your private practice. So your private practice, you focus on preventative care.
Yes.
Correct?
Yes.
And part of the preventative care is also weight management. Okay. So tell me how that began, where the interest began and how you developed the private care practice that you've got now.
So like I said, in the emergency room, I saw a lot of that, the need for preventative health and just health and wellness in general and, more education aspects of it. And I decided to kind of branch off and start kind of my own private practice and seeing my own patients. And since I'm not like a primary care physician, I try to focus on more health and wellness and dealing with preventative medicine. So
what does that look like?
I don't necessarily want to have patients where I have to manage a lot of, medical conditions all at once. So it's kind of like the healthy or the kind of patients that may have one or two things going on with them and not sure, that I try to, those are the patients that I encourage to kind of see and evaluate. So I try to do preventative labs, preventative, either send them to do either mammograms or colonoscopies, preventative, stress testing with cardiologists. And then when it comes to I've seen a lot of patients that maybe in their blood work they have, minor increases in cholesterol. And, the same way a lot of doctors okay, just fix it with, diet or weight loss, or just lose weight and come back. Or you may have a little bit of high blood pressure. So instead of placing them on high blood pressure medicines, I was like, maybe I know weight loss can improve this. And I've had a lot of patients, especially now, asking me, what can I do for weight loss?
Okay, so that's where we're going to start. This is when we're going to get down to the nitty gritty.
Yes.
The stuff that everybody wants to know. So, you'd be hard pressed to miss a commercial for Ozempic, for Wegovy, for Mounjaro. Is Trulicity included in this categorization of meds?
No, not necessarily.
Okay.
It works a little bit differently, but it does have some effects on GLP. Yeah.
So semaglutide.
Yeah.
Okay, and so these are all classified as GLP-1s.
Yes.
Correct? And try as best as you can to give the layman's
term,
example as to what a GLP-1 is. Because when I try to tell people, I'm just like, you know what? I have no idea. I just know this, it just works. But go on.
So GLP-1 is glucagon-like peptide.
Okay.
So peptides are the new kind of type of medications that the pharmaceutical industry is trying to focusing on, because they are either hormone-like or a neurotransmitter that can kind of mimics what we have normally, which we do have GLP.
So the word peptide sounds very innocuous. It sounds like, it's like just, it's a vitamin. It's a supplement.
Right.
But
it
it's not.
It can be.
Okay.
There are certain peptides that work that way, but
this one mimics like insulin.
So it mimics glucagon-like.
Okay.
So glucagon is basically the opposite of insulin.
Glucose.
Glucagon.
Okay. See, look, so the misinformation is starting already. Okay. So what's the difference between glucagon and glucose? Because they sound exactly the same.
They sound similar.
Yeah.
So,
and we make glucagon. Is that what you're saying?
Yes.
Okay.
So we have glucagon in our liver. So basically, glucagon is a substrate that pretty much it increases blood sugar levels. So it's the opposite of insulin. So when you eat, insulin is secreted to decrease your blood sugar levels. So when you are not eating or fasting or or not having enough glucose in your blood sugar, that when glucagon is activated. Okay. So they see now that despite, being diabetic, when you have higher levels of glucose in your sugar, they saw that glucagon now let's inhibit this because it's increasing now the levels of sugar in your blood.
Okay, so Ozempic's been around for a minute. I've heard of Ozempic for I don't know how many years now.
It's been quite some time.
Who had the light bulb moment where they realized that the active ingredient in all of this is semaglutide, correct?
Yes.
Okay. So who is it that had the light bulb moment that, hold on one second here, this could actually be used specifically as a weight loss aid in people who don't have any type of diabetes? Like everybody has been waiting for that one weight loss drug to come along that actually works. And trust me, I've tried a whole bunch of stuff. There was phentermine. Everybody in Hollywood used that. There was ephedrine, which was basically the same thing as phentermine. It's the same thing. You know, there's been all of these things that women and men, people have tried over the course of however long. But this one was a game changer. And I'm just trying to figure out who was it that discovered, wait a minute, this could actually be marketed as a weight loss aid, because now that seems to be all it's being used for.
Right. So it was accidental.
Mm-hmm.
So,
like penicillin.
Right. So it was kind of like, we made these drugs to fight type 2 diabetes. And then they found that these patients are, after being treated with these semaglutides, are losing weight. But they're also losing weight at a pretty steady kind of pace. And they're saying, well, maybe this can just be used for weight loss if it's so effective at losing weight. So then that's how Ozempic, Wegovy, Zepbound, those all became FDA approved for weight loss and type 2 diabetes.
Okay. I have friends that have type 2 diabetes, and they were taking Ozempic as a result. They haven't lost any weight. Maybe because they also continue to drink and eat whatever they want and don't really exercise. I don't know. But I've also seen people who kind of carried on the same lifestyle taking semaglutide or Ozempic, Wegovy, Mounjaro, and they still dropped weight. So what could be the disparity between those two particular
So in
people?
general, when it comes to the diabetics, it's a whole different realm. When it comes to how they, their whole metabolic processes are different. So when it comes to someone else who is just using this primarily for weight loss and they don't have diabetes or they're pre-diabetic, that is going to be more effective for them because of the decreased calorie intake, the appetite suppression, the increase of metabolic breakdown of fats and muscle, because of the fact of how this GLP is working in their system, in their bodies. So it's a big difference when it comes to the diabetics versus those just using it for weight loss.
So let's just say I have type 2 diabetes and my doctor prescribes Ozempic for me. Is the purpose of using Ozempic to try to get rid of my type 2 diabetes? Because it seems to be like there's an onset. Type 2 diabetes presents itself in people who, are obese or, or just gain an enormous amount of weight in a very short amount of time. Am I incorrect in saying that?
That could be.
Okay.
But also it has to do with type 2 diabetics they develop insulin resistance.
Okay. And so sometimes that's a hereditary thing?
No, not necessarily.
Okay.
It could be just because of they're gaining weight and they're eating too much carbs or things too much blood sugar in their normal circulation. Your insulin now is it's almost kind of trying to control it, but because there's an excess of blood sugar, it becomes resistant to it. It doesn't work as effectively. So these medications actually increase your insulin sensitivity, and that's why it works for the type 2 diabetes.
Okay. I'm wondering what your practice looks like in terms of your clientele, in terms of the ratio of men to women. But what I do know is that, I'm perimenopausal, and a lot of my friend group is, and, it's just, literally it's like waves in a pond, just now that I'm doing what I'm doing, a lot of women contact me and we end up in these kinds of conversations. But this has ended up being a game changer for women who have entered into the menopausal transition because, we tend to start to keep keep weight on.
Right.
We're not nearly as active as we were when we were in our 20s and 30s. And that's just simply because, what comes with, age, responsibilities and, lifestyles and that sort of thing. Also, it starts to feel like you're falling apart a little bit. Frozen shoulder, aches,
Right.
The recovery from the gym is not what it used to be. And so I found that when I started perimenopause, I've always had the tiniest waist ever. Like that was literally like my thing. And I started to develop a spare tire. And I was like, what is this? Like, what is this? And why won't it go anywhere? No matter what I did, no amount of fasting, no amount of exercise would get rid of it. So I've found that a lot of women who have decided to use semaglutide are in that perimenopausal or postmenopausal state, and it's been just a game changer for them. So I was just wondering what your clientele looks like, because most of the time weight loss and weight loss aids are really geared and focused and marketed mainly towards women. So I'm actually interested to know what the ratio of your practice is, like men to women, how many men you see versus women, and how many women are like in that postmenopausal state.
So I will say when it comes to, especially with, aging in the perimenopausal period, it's also contributed to the slowing of your metabolism.
That's true. Yes. I forgot about that.
Mm-hmm. So that definitely makes it a lot harder. Mm-hmm. But when it comes to my practice, I will say it's a lot more women. But I do work during for telehealth for the hims and hers. And in that, there's a lot more men. And I think it's also because it adds to kind of the discreetness of it. But I do see there are a lot of men that do want to lose weight and not necessarily know how to go about it and may not want to come to my practice particularly. But I do see it on that platform a lot.
Telemedicine. Perimenopausal women, we have so much to worry about. Men barely have anything to be concerned about.
That is not true because they suffer from ED.
Oh, that is a fact. Sorry.
It is pretty common, very common, very common.
And HIMS is...
that's their primary focus in the beginning.
Wow. So let's talk about contraindications. Just because I know I just used a really big word. What does that mean, layman's terms for the audience?
So those who should not be taking the medication.
Very simply put.
Yes.
So I wanted to talk about side effects, and I also wanted to talk about who is a really good candidate for taking these medications as a weight loss aid and who probably should not take it.
So contraindications, Ozempic has what's called a black box warning, meaning it's the highest FDA warning against the medication use in those who have any personal or family history of thyroid cancers. So that's the only black box warning. Contraindications can be because of the side effects, could be someone who is pregnant. It's not for, proof for pregnancy. Anybody who has any previous history of pancreatitis, any gallbladder disease, any allergies, obviously, to the medication. And when it comes to side effects, the most common side effects are the nausea, vomiting, abdominal pain, diarrhea, constipation. And this is because not only is its effects on changing your appetite or suppressing your appetite, I should say, it actually slows down gastric emptying. Mm-hmm. So when you eat, it actually holds the food in the stomach a lot longer. So while you're eating, you tend to eat less because you're feeling full and your portion is controlled in that way.
I saw an article on from CNN that basically was talking about stomach paralysis.
Yes.
What's the medical term for this?
Gastroparesis.
Okay. So they made it sound completely terrifying.
Yeah.
Is it as scary as they made it sound, or is this is just what happened? This is why you don't really want to eat, because food is kept in your stomach a lot longer than it normally would be digested if you weren't taking these peptides, correct?
So gastroparesis is not that common. Okay. It's actually is a long-term complication potentially for diabetes in itself. But what is actually more common, that some people who can have more of a susceptibility to gastritis or GERD, like reflux, acid reflux, those are actually much more common with the nausea and the vomiting because your stomach is just holding the medication a little bit longer than it naturally would. So like the GLP, it mimics the natural hormone. So it enhances its normal effects. So if it's normally a digestion process that say let last, 15 minutes, it may last 30 minutes, like let's say on that, for example. So you're going to feel full. You're not going to want to eat as much, so you're gonna have a decrease in calorie intake, and that it's gonna lead to weight loss. There's also kind of, especially in my practice, the way I kind of evaluate patients is some use a criteria for BMI. So that is your body mass index, your weight, and it uses your height and your weight to calculate it, but it has no specificity when it comes to fat, like how much fat do you have in your body. So someone who's a bodybuilder may have a very high BMI and be considered obese, which is a BMI over 30, or someone who has a lot more fat content in their body may also just be considered overweight. So generally they don't recommend the GLP ones for certain patients, especially if they're in that low to normal range of like overweight versus obese. However, you have to take in consideration the way I look at patients and I ask them, what's your lifestyle? What's your relationship with food? What's your relationship with fitness and how active you are? How do you manage your stress levels? Because of the appetite suppression and also it suppresses your thirst. So people become dehydrated because either they're nausea or vomiting and they're not actually even intaking water, for example. Those are all things that I kind of see. If your lifestyle fits this, it may work for you for weight loss. But if some patients come to me and they say, well, I just need to fit into like a wedding dress, or I just want to go get ready for spring break, so I need like 5-10 pounds, it's not going to work. I tell them it's not going to particularly focus on the areas that you want. It's generalized weight loss. You're losing fat. You're losing muscle. You may lose your butt. You may lose like some
there was
hips.
a thing called Ozempic butt for a second. Yeah.
Even Ozempic face because of the rapid weight loss. Like, there's
an upside and a downside to it.
So I try to educate on patients on, as long as you know the potential consequences or the potential effects of the medication and how you should really use it if for appetite suppression and not have that kind of that stress of cravings and, well, if I don't have that stress of cravings, let me change my lifestyle. And instead of having that burger, I'm just going to have like a different type of meal because I don't have that kind of appetite or that craving for carbs or that craving for meat. So I kind of look at it as, let's use it as an adjunct to lifestyle modification.
I read up on the class action lawsuit against Ozempic, and some of the, it alleges that these are some of the severe side effects: gastrointestinal issues, vision loss, death. Well, that's a hell of a side effect. Is that really considered a side effect? Well, medication, death?
Well, I would say the vision loss, it's particularly those two for diabetics for their retina. So it can cause diabetic retinopathy.
Okay, so a couple of the other ones were, which you kind of mentioned, gallbladder issues, gallstones, pancreatitis, thyroid cancer, kidney disease, and thoughts of suicide. It's kind of like, why would we take this if these are the risks that kind of come along with it? So knowing that, well, actually I have two questions. Why is Ozempic the one that has the A, black box warning, and B, the lawsuit, the class action lawsuit, when Wegovy and Mounjaro and the other one that you mentioned, semaglutide manufacturers, how come they're not being included in this? It seems like it's just Ozempic.
It's just because that became the most popular one, to be honest. They all kind of work the same, but Ozempic kind of just gained traction, and it's like the name. Right. And then, people generalized it, but when it comes to the semaglutides, it's really that's the general form. I will say that what a lot of the I don't know when it comes to the class action lawsuit, is that a lot of these medications, because they've been around for a while, and then they kind of gained traction when it comes to weight loss, and then they went through a shortage. So the people that actually really need it, when I say that, I mean the type 2 diabetics, they had a shortage. So a lot of pharmacies then in different places started compounding these medications.
What does that mean?
So when it comes to compounding medications, they use a lot of different ingredients, and they have the one active ingredient, which mimics the GLP-1, but then they have additives. So those additives can now cause issues.
What kind of additive?
So sometimes it's salt-based additives when it comes to the medication. But what happens is the compounded medications now, you have to really get it from a reputable pharmacy. So even pharmacies are nationally board certified as well. So what the FDA was pretty much recommending, because of the shortage, that, because of the shortage of these medications, there are some compounded forms that we technically can't say on effectiveness and safety, that we've gone and, tested these products. But because the pharmacy is board certified, then this may be safe for you.
Is the shortage over? Because I remember hearing about that, and everybody was just like, oh my God, you people with your vanity that want to lose weight.
Right.
There's people who need this medication, type 2 diabetics. You should be ashamed of yourself. Is the shortage still in place, or has it?
I mean, there's still a shortage on certain medications, and it depends on certain states across the country. But in general, there is a shortage of the medication. And that's why there's still, a lot of pharmacies that are compounding these medications.
I just had this idea of like a chemist in a dark back room, kind of like, like the mad organ player and stuff like that, just throwing this in the cauldron and this in the cauldron and this in the cauldron. How does somebody know that they are getting, getting something that is, I don't even know how to verbalize it, but basically making sure that this is not being made by some mad scientist, that it is a board certified pharmacist that knows what they're doing, and it's a reputable pharmacy. Like, how do you tell one from the other?
So these medications have to be prescribed by a doctor.
Okay.
So they have to be overseen by the physician, and you have the right to ask the physician, where is this what's the pharmacy, what's the name? And you can that's something that's easily Googled, and you can look up the pharmacy and see what their board certification, and if they're part of the board of pharmacies.
Is there anything else that we need to know about compounding, though?
Besides that, I think you need to know, one, where you're getting it from, and also those are kind of the issues when it comes to dosing, since it's not directly coming from Ozempic, or it's directly not coming from Wegovy. The dosing issues may be a problem, and that's when people may have more side effects, right? Because they're not either overdosed or they're not really getting the proper titration. So that's why I think it's even more important to make sure that you have a physician kind of directing you.
Titration.
Yes. So you have to start at a certain dose and pretty much building up slowly.
Okay.
In order for your body to accustom to the medication.
Y'all, I'm trying to make this as simple and in layman's terms as possible, because it is a lot of medical jargon. So when it comes to somebody deciding to do this, is there any kind of workup that you advise them to go get to, kind of assess whether or not they may be a good candidate or not?
Yeah, I think a complete metabolic workup, and that includes checking your cholesterol, checking your kidney function, which is your creatinine, checking your electrolytes, your hemoglobin A1C, which is a screening for diabetes, as well as your thyroid, because you may be not losing weight because it may be a thyroid issue, or it may be diabetes. It's not just let's go straight to that medication. I think a basic workup before trying these medications is your due diligence to do that.
Yeah.
Sure.
My last question is going to be about celebrities. We're not going to out anybody for who we suspect having used these peptides or meds or whatever the case is Oprah has come out and said that she has used these to assist her in weight loss. This is why she left Weight Watchers. Whoopi Goldberg has also been very vocal about having used it. I have used it. I've never really talked much about it because I wanted to have a medical professional speak about this with me while I discussed my particular use of it. And I know exactly what you're talking about the titration, because when I used it last year, I feel like I was given, the dosage started off correctly. I started off at 0.5 and then I went up to a 0.75. I feel like it was like 2 weeks at 0.5 and then it was 2 weeks at 0.75 and then it went up to 1. And that is probably where I should have stayed because I did not have an enormous amount of weight to lose. You know, I didn't have 40, 50, 60 or more pounds. I probably had about 20, maybe 30. And you guys might not know this because I'm a master of illusion. And so first of all, I was bowled over by how quickly I lost weight. Ooh, I looked so cute. I'm sorry. It was so great to put on clothes I have not worn in 10 years. But I did, as the titration went up, I did suffer those side effects of nausea, extreme nausea. I had to be very careful about how quickly I ate because that might just, signal Trigger. Just like a pray into the porcelain god kind of moment, I also started to feel looser, as in my muscle tone was starting to decrease. And I was like, ooh, this is a problem. I don't really like this portion of, the main event and whatnot. So, what are your thoughts on celebrities keeping it quiet and keeping their cards close to the vest? Because we just had a conversation, over there about offside about who we suspect having used it, and we're probably right on, but they've chosen not to reveal this, and I feel like there's a kind of stigmatization that's setting in around these meds as a weight loss aid and a good weight loss aid, a real, actual, alternative method to just, diet and exercise when you're older and your metabolism has slowed down and everything that you're doing is just not working. I myself I feel like it's a really good alternative. So what's your thoughts on celebrities kind of keeping this information close to the vest and the stigmatization that's happening?
Right. I don't think it should be stigmatized. But I also do understand that it's maybe their personal medical reasons. But when it comes to weight loss, I think maybe they feel like they did a cheat code or something like that. But I think even on these medications, you do need to have a lifestyle modification. You are going to lose weight, but the caveat is if you're off these medications, you're going to gain the weight back. So unless you change your lifestyle while you're on these medications to make better choices and to kind of rearrange, whether it's like a boost in your fitness program and things like that, that it's kind of a help. But if you go back to your old ways, you're going to gain the weight back. So I think when it comes to celebrities, I think they should promote that they were on these medications and also giving them kind of a real insight as to what they experienced, good and bad, whether they had side effects, whether they felt that it was something they're going to use again, because of whatever they went through. I think just suddenly appearing, 30 pounds lighter and saying that...
Sometimes 40 or 50.
Or 50, yeah. And looking like, oh, it was all me. I think it's also just like...
misleading.
It's misleading. And you're also kind of doing a disservice to the public because you're also going to have these rumors of whether or not you did it or not. And it's also just like, own it.
Yeah.
And also like, use your celebrity to either promote it or to show, your experience on it.
Yeah. Besides, obviously, my vanity, playing a tiny role, just a tiny role in me using this, I was starting to gain weight and my joints were so sore. there would be times I would be laying in bed and it would feel like the meat was falling off the bone. Like that's what it felt. That was the aches that I felt inside of my, inside of like my body, like especially like knee to thigh to hip. And it wasn't because I did anything, strenuous. It wasn't that I had, just, I don't know, power lifted 500 pounds. It wasn't because it literally was just from existing and laying down. And I was like, I need help. I just need help. And so I ended up talking to my physician about this, and we discussed you trying this out. And I think that my first go around, I learned a lot about it just in terms of the titration and just the dosage and how much my, little frame could actually handle and what actually worked for me.
Right.
And also you're absolutely right. The lifestyle, I had become a little bit sedentary because my job is to sit down and interview people and talk all day. I had to change that, find a boot camp, go there 4 to 5 times a week, find a trainer that was going to kick my butt, and also reducing the amount of alcohol that I consumed and just increasing just like all the healthy stuff. So you're absolutely right about, it just giving you that extra leg up.
Right.
But you really got to do the hard work. Okay, we like to do something fun here. It's called rapid fire. We don't do it with every guest, but I'm
special.
Yeah, you're special. So we're going to do a little bit of a rapid fire, okay? It's just going to be cheesy fun, okay?
Sounds good.
All right. First question. Light or dark?
Dark.
Okay. Coffee or tea?
Coffee.
Daytime or nighttime?
Nighttime.
Me too. Summer or winter?
Summer.
The beach or the mountains?
That's a hard one. Beach in the mountains, like Malibu?
Right. I know. I was like, can I combine the two? Taking a hike or Netflix and chilling, and it's a date?
Ooh, I'm going to do Netflix and chill.
Yeah, that's always the way.
Especially if it's a date.
Cats or dogs?
Dogs.
I know.
100%.
Is she beside you or is she under the couch? Oh, she left. Emergency room or private practice?
Emergency room.
Cookies or cakes?
Cookies.
Baking shows or serial killer docs?
That's tough because I love serial killer docs, but I'm going to go with baking shows for like my mental.
Okay. Bachata or merengue?
Ooh, bachata.
I said that like such a Canuck. Merengue.
Merengue.
Dr. Cynthia, thank you so much for joining me. I am so glad that you could join me and tell my audience about, GLP-1s and Ozempic and breaking the stigma and that sort of thing. So if anybody out there was curious about how this actually worked, then I encourage you to talk to your primary care physician about this, to find out if you're a good candidate, follow all the steps that he or she or they recommend to you. And, hopefully, you get the results that you're looking for. And thank you all for joining me again on Hot and Bothered with Melyssa Ford. Signing off.